Today's video is brought to you by Renew by Optimum Rejuvenation out of Bowling Green, Kentucky. Rejuvenate, uplift, renew, where wellness meets aesthetics. Whether you're here to unwind, refresh your look, or both, Renew is committed to helping you feel confident and revitalized. I want to thank Renew for our awesome chairs that we have for our podcast.
I've done so many different speaking out loud various things that I don't mind anymore.
Yeah.
Used to, it'd probably make me so nervous I'd feel sick.
Yeah.
But anymore, it honestly doesn't bother me.
When do you think you first started getting into speaking in general?
Public speaking, I would say the biggest aspect came in grad school.
Okay.
Because it really, I didn't like public speaking even then.
Yeah.
And it really made me come out of my shell.
So grad school, that being your physical therapist, so what were they having you, were you having to teach or were you just having to get comfortable?
I was just having to get comfortable, particularly because thinking about the curriculum, projects, group projects in particular, standing up, you'd have to do it in front of the class.
Yeah.
I still remember at the very beginning of grad school, them telling us we'd have a capstone project.
Yeah.
I don't feel like anybody was really worried about it or thought nothing about it. It was something you did at the end of the 3 years. I was so nervous thinking about that. I was like, I'm going to throw up.
Okay.
Well, just because, again, public speaking, your professors are there, and it's kind of like you present your project, research project you're working on, and as you're finishing this project, your professors are going to question you about it.
Yeah.
So it's like, if you don't know your stuff, they're going to grill you about it.
Okay.
And that was a very nervous thought for me, of being put on the spot in front of everybody. You know what I mean?
Yeah. So is that I guess, if you were to go the psychology or some other kind of science route, having to almost defend a dissertation kind of a thing, you're presenting something.
Yes.
And then you have to be prepared to answer.
Yes, you got to be prepared to answer anything. So if you haven't covered all your avenues, they'd call you out on it.
Okay.
So I think that was the nervous aspect of it, and honestly, church as well.
Okay.
In terms of just being called on to pray out loud in front of everybody.
Absolutely.
Super nervous at the beginning.
Are you still at Monroe Baptist?
Mm-hmm. Yep.
Okay.
Yep.
Yeah. How's Father Derek doing?
Hey man, still Derek.
He's
the
he?
man.
Is he?
Absolutely, dude.
Yeah.
He is the man.
All right. So, I do appreciate you filling this out. This is more than enough. So, tell me, I'm trying to do the math right now. So what, you're 33?
Yep.
All right. And 33, married, 3 kids, two boys, two girls.
Two girls.
Two girls and
Beckham's
a boy.
my baby boy.
Okay. All right. Because Reese threw me.
Mm-hmm.
All right. And to tell you how awful of a friend I am, I didn't know you had 3. I thought you still had 2.
Honestly, I've came into contact with a lot of patients, especially, that still thought I had 2. I was like, no, I got a boy. He's a year old.
Yeah.
So.
Yeah. And then married to Lauren. How long have you all been married?
It will be, let me count it up here. All right, 2000. I got to be sure I get this right. I think it'll be 7 years, January 5th. I believe it will be.
All right. We'll edit that out. We'll put a more assertive response in there.
It only throws me off because of the changing of the years.
Okay. Fair enough.
That's the only reason.
Yeah, just the changing of the years. All right. So let's look at your education. So you had a bachelor in psychology. I did as well. I loved it. What made you want to go that route? Just picking something, or?
I actually, before I landed on choosing to do physical therapy, I think I came into college, I was undecided. I just wasn't sure. I was like, I have no idea. There's too many choices. So I was undecided. Took a couple different classes to try to figure out what I wanted to do. I think I then switched to either health sciences or health administration or biology 1.
Mm-hmm.
I was like, this is okay. switched to something else. I was going to do occupational therapy. That was okay. And I finally got to the point, I think I was a junior. And I was at the point, I was like, I'm a junior, finishing junior year. And I was like,
Yeah.
I have to decide on a major so I can get this bachelor and really grind it out to get it.
Yeah.
And at that point, I'd actually taken a fair amount of psychology classes because I thought psychology was interesting. It was different.
Yeah.
And that was one reason I did land on psychology, because I was like, one, I'm already at the end of my third year and I've got to decide.
Yeah.
And I was like, with this degree, I was like, I can do a lot of things with it. And so at the time I decided on that major, I also decided, I was like, I'm going to do physical therapy.
Okay.
Coming into college, honestly, only reason I didn't decide to do physical therapy is because I didn't like the thought of staying in school 7 years.
Man.
I mean, truly, I was like, oh man, I got to get a doctorate. I was like, that's a lot of school. I'm already not a fan of school.
Yeah.
And so I did. I decided on psychology into junior year. And then the next, I believe, year and a half,
Yeah.
I had to grind it out big time every semester just to go ahead and get that bachelor's.
Yeah.
So that's how I landed on that.
Yeah. And like that education burnout, dude, like it's real.
Oh my gosh.
Because like you think you have all these lessons you learn like as a kid, like, or they try to instill in you, like, don't think of like everything that's ahead of you. Just think about like the next step, or think about how far you've come. But like once you're there, like you can't help but think like, dude, I don't want to do this. I don't want to continue. Like I know I need to, and I know I have, but gosh, I'm so burnt out. But I get it, man.
Hey, I tell you, speaking of that, I still remember in grad school on day one, we had a guy in our class that set a clock,
Yeah.
a running clock for 3 years.
Okay.
So however many days that was. And I remember we got to we had a semester that was really difficult. I think we had neuro and pharmacology and another class that were just very, very difficult.
Yeah.
We took a test in one of these classes, and practically the entire class just absolutely bombed it.
Golly.
Everybody studied hard. And I remember we was just sitting there in defeat, and somebody just said, man, I don't even know if I wanted to be a physical therapist anymore at this point. And then somebody's like, man, I'm in the same boat. I'm about done.
Yeah.
And it was just like, and like you said, man, the burnout. Oh my gosh, when you're grinding it out and you're studying and you're staying up late,
Oh yeah.
and you just feel like, oh my gosh, my brain cannot hold any more information.
Yeah.
It's just like you just start to lose your mind.
Yeah.
But you just literally say, I've came this far. I can't turn back now.
Yeah.
I've put in this much time and this much money. You're like, I have to finish.
Yeah. And I'll tell you, dude, because everybody that knows me knows that, you know, I come from a well-to-do or a well-off family, and there was a huge difference in the effort that I put in when Dad was funding it versus I was funding it. And when I was funding it, dude, like, no, there's no backstop, like, because I'm not going to have to pay this back in some way, shape, or form. I'm going to earn it. I'll figure it out from that point, you know? So
For sure, dude. It makes a big difference.
it makes a huge difference. So you went to Emory and Henry College for PT school.
Yeah.
So how long is that?
3 years total.
Okay.
Yeah. And every program's a little different.
Yeah.
So in a sense, they can set it up however they want. Ours just happened to be the first 2 years was all coursework in the class. And then our entire last year actually was just doing clinicals.
Okay.
So we ended up having, I think we had 3 12-week clinicals.
Okay.
So ours was longer clinicals all in the last year. I actually like that
Yeah.
because at that point it's like, oh yes, I'm done with the coursework. Now I can just focus
Yeah.
on 1 year of being hands-on. And, but I know other places like UK, for example, throughout their coursework, I believe that they still have it to where they're doing clinicals throughout.
Okay.
And I think it kind of might start in the beginning. It's a more shorter term clinicals and then gets longer towards the end.
Yeah. So I could see, especially if that's what you want to do, getting out of the classroom and into actually practicing being a huge positive. Was it like a breath of fresh air almost?
Oh my gosh. Honestly, it was just like freedom.
Yeah.
I mean, realistically, you went from just studying nonstop to it was kind of like you could put all the studying aside in a sense and then focus on learning the real application, useful aspect of it.
Yeah. Yeah.
And
What do you think when it comes to like studying things like book wise and how you picture it in your head, but then you're actually going out and practicing it? Do you ever notice a difference in like what the way you're understanding things as it's being presented in the classroom versus going out and actually practicing it?
massive.
Yeah.
And here's a prime example of the difference. So I'll never forget it. It was my last clinical, and it was an outpatient setting. So just its own building, people showing up, coming in, getting therapy for everything from surgeries to just general pain, athletes all the way to geriatrics.
Yeah.
And my first day, my instructor over me, who was an awesome guy, very intelligent, he said, all right. He's like, you remember all these things you learned in school? You learned special tests, how to do this, how to do that. I was like, yeah. And he's like, all right. He's like, that's good. He's like, now, just go ahead and just forget all of
Just
it.
dump it.
Literally. He flat out told me, he's like, just dump it. He's like, as long as you know your basic anatomy, how
Absolutely.
the muscles work, he's like, I'm going to tell you what you need to know. And I'm going to show you and teach you what you need to know to where you can treat people the way they need to be treated.
Yeah.
And 100%, dude, it felt like I dumped practically all my coursework. And he showed me how to treat the person. And it was a lot different. It's completely different than the book. It's kind of like the book just gives you the book definition of everything.
Yes.
But it doesn't always apply to the real world.
Yeah.
And my instructor, like I said, we went through those 12 weeks and he showed me practically the majority of things. He showed me it was stuff that I didn't go through in school at all.
Yeah.
So I was super thankful for that dude because it's like some of the stuff he showed me, I still use now. A lot of it, actually.
Oh, yeah.
And if I hadn't had him, I wouldn't know any of that.
Yeah. I like to think of the stuff because I tend to be, so I guess you could say a rigid thinker. Like it's good to be able to think outside of the box, but I've had to learn like actually how to do that. And so when it was coming to like mental health therapy, like in my mind, I'm doing exactly what I'm taught to do, but it just doesn't feel right, you know? And I think of just think of your standard hand tools, like a screwdriver. Like, yes, you could obviously use a screwdriver to screw in screws or whatever, but like, I mean, you can use it in various ways, you know, like you just got to be familiar with I say you can use a screwdriver in various ways. I'm trying to think, like, I know you can't, people pry crap open, you know what I'm saying? Like you can figure it out. And that's what education I feel like does and should be, you know, is teaching you what it is. And then you just going around and experimenting with it and then figuring out, how do I make this work? You know?
Yes, I agree. It's kind of like even now looking back, the basic core concepts of therapy, for example, like the most basics is what I use in terms of just what does this muscle do? How does it work?
Yeah.
And then it's like from there, it's like learning how to take that information, manipulate it and use it to where it's useful.
Yes.
But also the other half of it, and I'm going to say at least half of it, is because I'm dealing with people every day, and this is the same for you, and I'm sure this will definitely apply. Because I'm dealing with people every day, if I don't know how to connect with them,
Yes.
they will not want me as a therapist.
Absolutely.
So like from the get-go, you realize if you cannot connect with your patients,
Yeah.
they won't want you.
What's your experience with like patients? Can you tell, like, do you see more success? This is probably more when we get into actually your job experience in and of itself, but do you come across like patients that you can tell just don't want to be there and just have to be there kind of thing? And if so, how does that affect their outcomes in the long run?
Oh, without a doubt. Of course, I do home health.
Yeah.
So I strictly am going to everybody's home every day where they're most comfortable, which is great because a lot of people, they love it. They're like, you come to me, I don't have to leave the comfort of my home. And I like it too because, I'm constantly traveling and staying busy.
Mm-hmm.
But there's plenty of places we'll get a referral.
Mm-hmm.
I'll go out and first visit, I make sure to get a good read on people. You can tell who wants it and who doesn't.
Yeah.
If I think that somebody does not want it or I do not think they will participate, it's going to be a waste of their time. Mm-hmm. So I will oftentimes, before the visit ends, I'll say, look, here's what we would do and here's what we would focus on. I am more than happy to come out, work with you. Here's how often we'll do it. Mm-hmm. This is what we'll do. But I want to make sure that you want to do it and that this is something that you're interested in.
Yeah.
And I got some people, they'll say, oh, yeah, that's what I want to do. I'll have some that will tell me flat out, they'll be like, I'll be honest, I don't really want to do it. Or my doctor just referred me and I didn't really know what I was getting into. And I'm like, that's fine. I'm not going to force you. This is your choice. But I do get some, they'll be like, yes, I'm all for it. Like, I'm motivated. Let's get better. And then we actually start doing it. And then it turns into, well, I couldn't do any exercise the last 5 days because I just didn't feel good. I'm like, okay. Well, then you start seeing a trend sometimes. And again, this isn't everybody, but you can get a read very clearly up front for a lot of people based on how they respond and from that first visit.
Yeah, absolutely.
And every time I show up, I'll ask people, did you do your exercises we talked about? Did you do the things we talked about? You can tell when they have and you can tell when they haven't.
Yeah.
And
yeah.
But it's one of those things of if you don't do it or do what we ask on a regular basis, it's not going to do you no good.
Yeah.
Flat out. Like I might show up to a house 2 days a week for an hour each visit. I mean, that's 2 hours out of a 7-day week period. And I tell people, I'm like, you have to do this on your own or this will not help you.
Yeah. And that's the same thing in the mental health field. I mean, there's work to be done and ground to be broke, like while you're in session. But if you're not actively, I would say, reflecting or recalling what we've talked about in session to change how you approach things, then your experience isn't going to be any different. And you're essentially, every time you come in, we're just going to have a vent session. And that's fine. Like sometimes, and there are people too, like that they're actually very independent, efficient people, but maybe they've taken on too much, or maybe they're experiencing some burnout, or maybe they just need some like encouragement, and like that, I'm fine with that. But I would imagine too, that would be kind of for you, like if you're working with an athlete that is super, like that knows what they're doing, you probably trust them a little bit more, or do you not? Are you just as hard on them? How do you approach it?
So, in regards to that, well, it's kind of like, for example, I mean, I've got a patient I had recently, older individual that, right from the get-go, I could tell he was really motivated and really one that wanted to push himself to get better. So I could tell he was doing everything I was asking. So I was actually pushing him harder.
Okay.
And progressing him harder because I could tell he wanted it.
Yeah.
Now, I don't get that a lot of the times, though. A lot of times I get the opposite, which will be somebody that, for example, let's say I've got somebody that's just, I've picked them up because they just had pneumonia and they're weak.
Yeah.
Just breathing heavily, just bad endurance. I've got some people I'll pick up and they'll have a limit to what they want to do.
Yeah.
And so I've learned where their limit is. And it might, like if you saw me exercising with them, you might be like, well, they didn't hardly do anything that visit. Mm-hmm. For them, though, they might have saw it that they did a ton of hard work. So for some, it's kind of like you start real low and then work your way up to where, one, you build their confidence and they feel like they're getting better, but also allow you to start pushing them. Because some people, you push them too hard from the get-go, they'll flat out be like, I want to be cut loose from therapy. I don't want to do this.
Yeah.
So
is it an intimidation or is it like a burnout?
I would say the combination between less burnout. I would say for some intimidation. I would say a lot of just honestly just laziness.
Okay.
Because I'm flat out, you've got some people, they just don't want to do exercise. And I understand it. Exercise isn't for everybody. And you've got some, they're just not active at all in their daily life. And so you introduce to somebody, well, let's do these squats. All right, well, let's move these weights.
Yeah.
Especially where they haven't done it their entire life. That introduction gets rough and they look at it like, oh, you're going to kill me.
Yeah, it makes me remember the very first weightlifting that we did with John Pettit, like my 8th grade year. I hadn't lifted a weight. I hadn't done it, dude. I just not morbidly obese, but nowhere, not in any amount of shape whatsoever. And that next day, trying to go up the steps, I was just awful. I have never hurt. I've hurt my back, and that's awful. But like, I have never hurt full body like I did that very first time.
Well, and that's relatable to some people that I've had that have never done anything and, well, never worked muscles that I'm trying to work with them.
Yeah.
And some of them, if it hits them too hard and they can't handle it, they'll turn away from you.
Yeah.
So that's why it's like I have to get a good read and pace them where I think they're at in terms of this.
Yes.
This scale of, all right, how much do I want to do this? How much drive do they have? How much motivation?
Yes.
And how much grit and perseverance? Because not everybody has those qualities.
Oh yeah.
And you, I'm sure you know that. You can see that in your job.
Yes.
And
absolutely.
so it does. I'd say there's probably more that goes into reading people than honestly a lot of times even just doing the therapy. Because you got to get it right.
Yeah. Real quick, because I don't want to jump around too terribly much. How long have you been practicing physical therapy?
So it'll be, I believe now, I've been practicing 6 years. Yeah. Been 6 years, going on 7 years actually.
Yeah.
Pretty soon.
Yeah. Does it feel that like it's been that long?
The crazy thing is it doesn't. I mean, I'm talking I can still think of the other day whenever I started this job. Of course, I've been with this company since I got out of school. But it's wild. I mean, it has flown by. Doesn't feel like it at all.
Yeah. Do you like and you can mention the company if you want to, but you don't have to, but like is this something you want to stick with? I know you kind of mentioned that maybe you would like it at some point to have your own. So is that more to do with just like personal aspiration, or is that just wanting to,
Yeah, honestly, and I think that's more of a personal aspiration. I'm very happy and very content where I'm at.
Yeah.
All around, I feel very blessed where I'm at. All my coworkers, love them all, love my boss. I mean, we get along great. I feel like I've got a great schedule.
Yes.
I really have a lot of boxes that I can check off that I feel a lot of people can't. Now, obviously, if I'm looking at professional aspirations or dreams, I mean, realistically, sometime in the future, a goal would be to open some type of practice of my own.
Yeah.
Whether that would be try to do home health or outpatient or something else in between, because the thought of owning your own and running your own and building it up.
Yes.
For me, it would be like a proud moment, to do that, be successful, and then have the control and flexibility to do what you wanted and needed to do. You know what I mean?
Absolutely.
I'm content being an employee for my company because, like I said, they've been great to me.
Yes.
But an ultimate goal, would be to actually build something up of my own, for sure.
I relate to that a lot, and I think, which my life's going through some major restructuring right now as it is, but where I'm at right now, I feel blessed as well, because if I wanted to stay there, and I do, Tammy, want to stay there, I'm completely fine, because I love the environment. I love they're my family, and I don't tell them enough as it is, but like living here in Lebanon, it's like I don't have family here. They are my family.
Yeah.
You know what I'm saying? And so those relationships, which I've been there for 2 years, and I'm the only male beside, there's one other, but he's not there full time by any means. And so there's a lot, and then coming from the military to working with all women, like there's, excuse me, like we butt heads at times and things like that. And there, and usually I'm the instigator in these little conflicts that we have, but I mean, they're my family, and so I wouldn't trade them for the world. And I think I'm saying this to say I'm very blessed to know that whether I stay or go, I'm going to be fine.
Yeah.
But I'm staying.
Yeah, for
All
sure.
right, I'm staying.
And I'm there with you. I am very content if I stay here the next, honestly, 25, 30 years, however long. Because like I said, and same situation it sounds like for me. I'm actually, aside from one other male, I'm the only male in the office that coming and going on a daily basis. But yeah, love everybody. I'm blessed. I can't complain a bit.
So one of your hobbies that you have listed here is Bible and Bible history, and then church. Church I know goes without saying. Faith goes without saying. When it comes to the Bible and Bible history, is this more or less studying like a historical, factual studying of the Bible? Is it? Can you elaborate on that a little bit?
So, of course, like anybody else that's Christian or goes to church, you read your Bible, or supposed to anyways. So I've got to where I'll read my Bible, but I've got some other books that kind of elaborate on the history in detail of the Bible and like what's going on at the time. I know, so here's an example. I bought this the last time that we went to, I don't know if you've been to the Ark Encounter.
Yes.
Okay, so you have, yeah.
I have.
So pretty amazing, literally full scale size of the Ark depicted. They had a book there that it was about yay tall, literally, from the ground.
Yeah.
I'll be honest, I've went blank on the name of it. It's a very famous, popular, I guess you'd call it map type manuscript. But what it is it's basically a history timeline.
Okay.
Starting from the beginning, like the very beginning, so Adam and Eve.
Yeah.
And on this map, which actually folds out and would be, when you fold it out all the way, like when first time I unfolded it in church, it would be like this entire room, probably plus another one at least. Like it's that long of a map.
Yes.
But as you go through it, it's got the Bible history, but then it also has the history of what's going on in the rest of the world.
Yeah.
So you're looking here at the Bible timeline, you see all this happening, and then you can look down here and see what's happening in China at the same time.
Yeah.
And then when things are getting invented down here.
Yes.
So it gives me another viewpoint of what's going on, and that's just one example. I like looking into, every now and then I'll get online and there's a couple different news sources that we'll talk about whenever they found a new archaeological find relating to the Bible. And
super awesome stuff too, man.
Yeah,
it's very reassuring. Not that my faith is wavering, but like seeing archaeological stuff, like have the less faith sometimes I have to run off of, the better, because my faith meter will.
Well, and I think that's a lot of people. I think it's honestly natural just for us people, mankind, period.
Yeah.
I think we have moments where we feel like our faith is up here and we feel like we are just like so close to God. And then we have moments in life, we feel like we're so far away. We're like, man, I bet he doesn't even hear me. He's not even in the realm where I am.
Yes.
You know what I mean?
I do. I know exactly what you mean.
And, but yeah, I feel like I'm trying not to go down a rabbit hole. No, sometimes I do it.
You're good. But yeah, I mean, and talking about, and another thing, what I want to do is I want to be very, very real. Not, I don't want to go, I'm not going to self-disclose like, my absolute worst things, but even still, I think I've grown up in my life, like very ashamed of certain things and people being like, dude, that's not that bad. But what I'm getting at with that is, talking about your faith being up here. Like I think about David, like having the affair with Bathsheba and like getting her pregnant, having Uriah, her husband, killed, for those that don't know. And then like the Bible describes him a man after God's own heart, and that's not a reflection of God in his actions. It's just like, that's how awful we can be.
Oh yeah.
We can be very, very, and like, I think about like Peter, because Peter cut the guy's ear off. You know what I'm saying? Like, we can never, we're never above doing a completely horrible wrong thing. Yes. And I'm not, there's not a subtle, like, I do completely horrible wrong things. That's not what I'm getting at either. I just think there's a certain, I wish as Christians we could be a little bit more open with the difficulties that we do have at times.
I completely agree. Honestly, I think it would make the world flow a little better.
Yep.
I think the problem is obviously the shame and guilt that comes with it, because everyone's not open with it all. You're like, well, I'd hate to say that, I'm in a room full of people that appear to be perfection.
Yes.
Or we think it, even though it's never the case.
Yeah.
But going back to the story you mentioned with David, that story, along with many others in the Bible, I almost at times when I read that, I get a feeling of almost some reassurance of thinking, I don't have to be, it's okay if I'm not perfect.
Right.
I should still strive to be perfect. I should strive to be like Jesus. But when I do mess up, don't just pull myself out of church and feel like I'm so unworthy I don't need to go back. You know what I mean?
Right.
Because even the people, the greats, many of the greats in the Bible that did wonderful things, had moments like David that did absolutely terrible things.
Yes.
And that is kind of reassuring for me.
Yes.
Knowing, okay, well, they wasn't on this perfect pedestal like Jesus. They were also human like me and had their moments.
Yeah, absolutely. And I think too, I think part of it was growing up. I'm not talking bad about Tompkinsville or Monroe County, but we grew up in a bubble. I will say we grew up in a bubble. You've kind of stayed there.
Now, I left for a while though.
Okay.
I don't think I put that in the notes, but
okay.
So I lived in Richmond, Kentucky for 5 years. Then I moved to Virginia for 2+ years.
Okay.
Yeah.
So what would you say the atmosphere is, as far as, well, one, let me ask, would you describe aspects of Tompkinsville and Monroe County as we were growing up as judgmental, or at the very least strict, as far as like expectations of behavior compared to other places that you've lived in?
I think there was more of a I guess the word I'll use is strictness, in a sense of, in our county in particular, is very church oriented.
Yes.
There are many churches, if you count them, in our entire county, a lot of churches. And I did notice a big difference between the 8 years I was gone of living different places, between our county and others.
So where I'm going with that is like, because there's been some changes as far as like, people can, they sell alcohol and stuff now. Is there a difference in the experience now versus what it was growing up? Does that question make sense?
It does. I do not see a difference personally. Like you mentioned with the alcohol sales now there's multiple places that sell alcohol, but since that change has occurred, I haven't heard or seen personally a difference from the prior.
Yeah.
So
like,
that's just me.
'Cause like, I'm going to say we, not to include you in this, but we would have to go to the line if we wanted to purchase alcohol growing up.
Yeah.
And we didn't want people knowing.
Oh yeah.
And so like now, like, is that still the same experience? Like, would you be ashamed to be caught dead in a, maybe not you specifically, but in the general population?
I see what you're saying. I would say for a lot of people that is probably still the same.
Okay.
And the reason I say that it probably is because I feel like there are individuals that during their personal time they may like to take a drink.
Yeah.
But because of the church, whichever denomination that they go to, it may be frowned upon highly.
Yeah.
They're never going to make it known.
That's
So
kind of,
even though the stores in particular, a couple are open right in the middle of town, I highly doubt those individuals would ever go to those stores because of the perception from other church members.
and so like I'm not in the least trying to promote. I don't want it to come across like I'm trying to promote the use of alcohol or consumption of alcohol. It's that, you know, I grew up I would say just personally just feeling like ashamed with some of the stuff that I struggled with and I didn't feel like I could tell anybody about.
Yeah.
And then I wouldn't, not that I want to be able to go to Monroe County and purchase alcohol and feel great about it, but I guess I'd like to be able to still go back home and know like, hey, if I talk about some of the struggles I've had in life, like I'm not going to be frowned upon. Like people are going to be like there's a testimony in that. But you know, if you're shamed for going into the liquor store openly, I'm definitely not going to be open about anything that I've struggled with outside of that. Does that make sense?
It does.
And so and now that just may be me personally.
Yeah.
That may not everybody may feel that way, but that's something I've always struggled with. It's like I can't be anything more than human at the end of the day, or anything beyond, you know, what sanctification has occurred in my life as a result of Jesus, you know. And like I always want to be able to be honest. And so but yeah, I was just kind of curious about that. But that's a good conversation because it leads me into what I have a little something for you, but it's nothing crazy. No alcohol, no drugs, nothing like that. But this is for you. So I'll have you go ahead and open it. You don't have to read it, but I want you to go ahead and pull out the gift that I do have for you.
You didn't have to do
And
that,
then
man.
kinda, dude, it ain't much of nothing. All right. So don't. So it says Jesus is my AG. Okay.
Yeah.
So we'll do this together and we'll practice a little bit of, it'll give you an idea of how I approach mental health therapy. So if you could can you pull out you have your phone?
Yeah, dude.
So go to Google.
Okay.
And we'll try this together. We'll just see if we can do this together. And then type in, let's see, U.S. Army Infantry, and then gun team. I know it's a lot, but
No, go ahead.
gun team AG. All right. And then does it give you the AI overview? Does it pull up that right there?
Yeah, it does.
Okay.
Yeah.
Can you read down to where it don't read AG roles and responsibilities, but just that summary paragraph there? Would you be able to read that out loud?
Yeah. It says, in a U.S. Army infantry gun team, the AG stands for Assistant Gunner, who supports the primary gunner of a machine gun. The AG's duties include spotting rounds, carrying extra ammunition, helping with barrel changes, and being prepared to take over the gunner's role if needed. The team typically also includes an ammo bearer and can be part of a larger weapon squad.
Okay. So in general, the AG is going to help the actual gunner. All right.
Yeah.
And so, which that right there, If you look up on the flag
I
there.
noticed that when I came in.
Yeah, so those are the 240s, okay? And so there's a gunner. Jesus would be the assistant gunner, okay? So he's going to be so now going back to kind of what we just talked about. I know you put your phone, but like how would you relate like if we were to look at the Christian life as being a gunner and Jesus being an AG? It's like do you see parallels in that and like what the AG does and then what the AG does for the gunner and what Jesus does for our life? I know it's kind of probably putting you on the spot.
Yeah, I see what you're saying here. I'm gonna read this one more time.
Go ahead. Take your time. The reason I like to do this is because I think it helps to have different ways of looking at things. And having Jesus as your AG, it's like...
Yeah, I mean, I definitely understand what you're saying here because it's kind of like if I am the primary gunner,
Yeah.
for one, I have to have the AG.
Yes.
If I don't have the AG, then I literally can't do my job.
You're right. You can fire your gun, but they're going to be telling you where you need to shoot. They're going to be telling you, you know, like how many rounds per burst. All these different things. They're giving you that good guidance. You know what I'm saying? And so, but yeah,
absolutely.
And so like, anyway, can you show them? I don't know if you did, but can you show, I guess, to your camera?
This one here?
Yeah.
Let's see if I can hold it up to where maybe it can be seen pretty.
Talk a little bit louder in your mic. So the camera's on you. Or here, let me have it, and I'll put it up.
Yeah,
there.
you hold it up a little closer.
So it went back. There we go. They can't probably see it, but
If
it
you
does
need
say
to.
Jesus is.
I was gonna say if you need to turn it to that, you might be able to see it clearer.
Here we go. Yeah. Anyway.
Yeah. So in case you couldn't see it, it says Jesus is my AG.
Yeah. So, yeah, Jesus is your AG, dude. So if you're a Christian, Jesus is your AG. And I hope I didn't, because I had that saved. And I put that I put this verse in the card as well.
I saw a verse in John, I believe.
John 15:4-5. Do you mind if I read that real quick?
No, go ahead.
All right. John chapter 15 verses 4 and 5 says, "Abide in me and I in you, as the branch cannot bear fruit of itself unless it abides in the vine. So neither can you unless you abide in me. I am the vine, you are the branches. He who abides in me and I in him, he bears much fruit, for apart from me you can do nothing." You know, and to me that's like, all right, Jesus my AG, he's going to tell me what I need to do.
Yeah.
And another parallel that I like is the fact that if the machine gunner goes down, the AG then picks up that role. Yeah. And I think like as Christians, I mean, dude, we can go, we can fail, we can, you know, collapse on our walk, whatever, but Jesus is still there to make sure that we get up, we do what we need to do. Yeah. He does our job for us if I'm being honest. Yeah. You know, and so, yeah. But anyway, what I want to do is I want to get more of those stickers, and I'll go ahead and plug the Patreon account. But on Patreon.com, you can go to Google and search Patreon, the Average Joseph Podcast. People can subscribe for $5 a month. It's not a have to, but what that's going to do, what I want to use that money for is charity donations like every month or so. And then whoever the guest is, purchase some kind of gift or a meal or whatever. You know what I'm saying? Yeah. That's cool. Yeah. So that's what I want to do with that. Yeah. So we'll go ahead and start going through. We talked a lot about physical therapy in and of itself already, but we'll kind of try to hit anything we've looked over. So, first question is, can you talk about how physical therapy isn't just for injuries, but can enhance overall wellness, prevent issues, and improve quality of life?
Oh, yeah. I like this question.
Yeah.
This is right up my alley.
Okay.
This question in particular is one that I really love, and here's why. So, yes, physical therapy, most people look at it like we are showing up to treat you for whatever problem you got going on, whether it's you've had a hip replacement, cardiac surgery, you've had a fall because you have poor balance, you got dizziness, you're just generally weak or short of breath.
Yeah.
That's what most people look at it as. If they're showing up, they're going to have me do exercise and build me up. And that is part of it. But one of my biggest things is I see a lot of people that every day you make decisions from the moment you wake up to the moment you go to bed on everything. And me personally, I have a belief. I have a belief in one, self-discipline.
Yeah.
I'm very big on self-discipline. I think that is one of the keys to life, to not only just get through life, but get through life the way that you want to get through life and to accomplish goals and accomplish things. And so the moment you wake up, choosing whether or not you're going to exercise at some point that day, or choose whether you're going to eat a healthy meal, whether you're going to learn something new by sitting down and reading an article or a book. Every day you got to make decisions to better yourself. And I feel like personally, everyone needs to wake up every day with the idea of, I'm going to better myself more today than the last. I'm going to do something. It can be, I'm going to start making my bed every morning.
Yeah, for sure.
I mean, it doesn't have to be anything major. It doesn't have to be a full-on strict diet. It's just making smart changes. And one thing, at least in regards to the therapy aspect, is I feel like I see a lot of just individuals at times that they've went through life and they just haven't generally taken as good care of themselves as they could have.
For sure.
And as the days, the weeks, the months, and the years pile up, the repetition of those choices eventually lead to consequences. And that can be consequences in terms of just your heart health, brain, everything. And I just wish so bad that I could just sit down with people just to spend time talking about just basic things of just being active, eating better, making better lifestyle choices. Those three things are just massive. And I see people for therapy that have certain problems going on that could have probably never even been a problem in the first place if they had looked at those three things. And so I am a huge advocate for wellness, and I would say preventative wellness.
Could someone like say myself, like maybe I'm just like, well, I do deal with lower back pain and I know why, but let's say I didn't, right? And let's say I didn't, like, do I automatically need to go to the doctor and then get a referral, or could I make an appointment with you or a physical therapist to just kind of go over that, and maybe even just like, is it possible to have just an examination to kind of get an idea of what could be improved upon without having to go to my doctor first?
Yeah, actually it is now, and I don't think a lot of places realize that, but years back, within the last, I guess, 10 years, they've changed something within physical therapy, and it's called direct access. So now actually, we'll take an outpatient clinic, for example, one down the road. You actually could show up to an outpatient clinic off the street if your back was hurting and say, my back is really hurting, I'd like to make an appointment. And you could get an appointment for them to evaluate you. Without having to get a referral from your primary doctor or your whoever. Used to in the past, it wasn't like that. Now on the subject of some people, like that may happen to, let's say you get back pain one day and you're like, oh, what should I do next? I would say it all boils down to one, how bad is it bothering you? Is it affecting your daily life? Is it something that's preventing you from doing things with your family or just doing things around the home? If it's something that's really hindering you, I'd go get it checked out, because that's something you want to address pretty quickly. Now, everybody's got a preference on what they want to do first. You got some people that right off the bat, they want to go to their primary doctor, and that's fine. You got some people, if it was back pain again, since we're on the subject, they might want to actually first go to a chiropractor.
Yeah.
Everybody's got their own thoughts of what will work and what will work the quickest and most effective. So oftentimes, even when I've showed up for a first visit, people will ask me, they're like, what do you think I should do? And I'll check them out. I'll tell them my opinion. And they might even ask me, they're like, well, do you think it would help if I went and done this? And went and done this. And oftentimes my answer is, it could help. And if I don't think it's going to, cause any further damage or an issue, I'm like, go try it.
Yeah.
If you think there's a chance that it may improve your quality of life, absolutely.
Yeah.
Try your options,
For sure. For sure. So, like, I could, in theory, just go to a physical therapist, but what would you tell someone to do? Like, I know you said it depends on how bad it is. So with severity, how would you use severity or intensity of symptoms to determine whether they should go to like a primary care first or just try to meet with a physical therapist first? Does that make sense?
Yeah. So if somebody comes to me, somebody was to come in or call me even, and they're like, hey, man, I was working yesterday. I fell, or I was doing something, lifting something heavy or pulling something, and I've had the worst back pain ever. And it's so bad that I can hardly walk. I can hardly even bend down to tie my shoes. Like, I literally cannot function. I'm about crying. It's that bad.
Yeah.
If it's something like that to where it looks like they have suddenly caused a major issue, I'm like, okay, you need to go ahead and go to your primary doctor.
Yeah.
Let's make sure you haven't pinched a nerve or, slipped a disc or broke anything, if they had a fall.
Yes.
It's all situational, more than anything.
Yeah.
Now, if I had somebody that calls me up and they're like, hey, I am having just hot flashes and cold sweats, and out of nowhere, my left side of my face has just went numb.
Yeah.
And my left arm is tingling and numb, and I don't know what's going on.
Oh, man.
I'm going to be like, all right, you need to go to your doctor immediately or go to the hospital.
Go to the hospital, absolutely.
Because it could be a heart attack.
Yeah.
So it's all situational.
Yeah.
More than anything. But one thing I will say is I am very straightforward with everyone I see the first visit. If I think I can help, I'll be like, hey, I think I can help. We'll try it and see. There might be somebody that if I don't think I can help, I'll tell them. I'll be like, hey, I think honestly your best option at this point is you may have to go to the pain clinic. Your pain has been chronic for years, and it has now gotten significantly worse over the last couple months to the point of you're almost not walking.
Yes.
You've had multiple back surgeries. We've hit a point where I don't know if I can help anymore. So all situational, but I try my best to send people in a direction if I didn't think I could help that will help them the quickest and the most. So
bottom line up front, there's not one specific criteria that you go off of that determines the care. That you need to know a multitude of things, including, and I would assume, so like, let me ask this. Let's hypothetically say, I have a brother that's had a back surgery, but degenerative disc disease and things like that. My sister has also had a back surgery. Let's say hypothetically I was deployed in 2018 and I threw my back out and had minimal care, and I've had chronic lower back pain since then. All right. And I've taken care of myself besides being chunky. But I've taken care of myself. I've got good mobility, all that good stuff, but I still deal with chronic lower back pain. Maybe it's alleviated occasionally by getting a good chiropractic pop or popping from stretch. Do I have back surgery in my horizon? Or is it hard to say?
Honestly, it would be hard to say. In that case, like if you were seeing me for the first visit, and let's say you told me that exact same situation, I would dive into getting all the details I could possibly get from you.
Yeah.
Because the more information you can give me, the better idea I can get as to how much can I help you, and how long and what I'm going to do in order to help you.
Gotcha.
So, and back pain is one that it's different than a lot of other pains because, I mean, I've seen people that have some back pain that it's killing them. They're on pain pills for it, and they can hardly walk. And I evaluate them, and I'm like, you know what? This looks like it's more of a sciatic nerve pain.
Okay.
I think I can help you. I think that is the only or primary issue. And then I work with them for a bit, and then 6 weeks down the road, they feel great. They're fine, not even having pain no more. And then again, other end of the spectrum, have somebody that has pain. I work with them for a bit, and they might not change at all.
Yeah.
Pain might stay the exact same. And if we've looked at the options, I've tried everything I can think of. Sometimes I'll be like, hey, you know, we've tried everything. Your pain is the exact same and hasn't changed. You know, at this point, you might need to look at going to see an orthopedic surgeon.
Yeah.
But my biggest thing is in regards to surgery on that subject, surgery is my last option.
Yeah, that's what I hear. That's what I hear.
I'm always going to make it the last option. I'm going to try every other avenue prior to going and seeking the option for surgery.
Yeah.
I am one that I believe that surgery, you get it when it's essential and absolutely essential. Because I just think that in the long run, once you start making the modifications to your body, you know, putting in hardware, you know, a lot of complications can go wrong.
Absolutely.
I've seen plenty go wrong. And so that's why I typically try to advise all your other options and resources before you get to that point.
For sure. Fair enough. That's all hypothetical, you know, no reason that I'm asking, but,
I was going to say one more thing.
yeah.
And I would even say this, just like every doctor, every surgeon, every therapist, everybody has an opinion. Our opinions are not on the same level of consensus all the time.
For sure.
So you might go see one therapist that says, hey man, we can fix this. Okay. And they might fix you. They might not.
For sure.
You might go to another therapist, says we can fix this, and they actually do. So I always will even recommend try other opinions.
Yeah.
Try other opinions, try other people, because as you well as know as I do, even in therapy, you can get all sorts of further education and specialties and certifications in different areas.
For sure.
You might see one therapist.
You got to fly.
I keep thinking I'm seeing it, but I don't know if I am or not.
You don't know if you are or not. I don't see it, but if you do, you do.
But long story short, you'll be surprised where, you know, one person might not be able to help you, but somebody truly might be able.
Absolutely.
So I tell people to really take advantage of any resources that you think can help.
Fair enough. Well, you know, I do have the VA, and I'm getting more involved with them. Because I'd rather have, well, and I'm not even going to talk bad about the VA, because I do think you can tell when they're trying, and the people that I work with are trying, and I'm going to work with them to maintain, because I do not want to have back surgery. But again, that's all hypothetical. So, are there any popular myths, fads, or controversial topics in physical health and therapy that either drive you up a wall or that you want to talk about?
Oh, yes, there is. We'll start with certain infomercials.
Okay. Let's go, dude. Because let me just, I'm gonna rant. There's a certain, and I'm not gonna say the brand, but there's a certain infomercial that shows up for every freaking YouTube video, and it drives me up a wall when they're talking about, you know, cardio doesn't burn fat. It like, shut up, you know. But anyway, go ahead, continue. Didn't mean to interrupt.
So we will start with various commercials showing and advertising products that will heal certain issues with people.
Okay.
We'll use the subject of neuropathy as one. And this is just the first one come to the top of my head. I can think of a commercial that came out with this vibrating foot machine.
Okay.
It might warm the feet as well. I don't know, but it tried to go into the science of how it was going to completely heal your neuropathy.
Okay. Can you explain what neuropathy is to the layman?
Neuropathy is the sensation of burning, tingling, numbness that you will oftentimes, a lot of people will get in their feet and can get on up the legs, sometimes in hands.
Yes.
It's just, and it's oftentimes a lack of just sensation. So like you can have somebody that might have a lot of diabetic neuropathy. That's what's probably the most well known. People having diabetes that lose a lot of feeling in their legs and feet. So much so that there have been people, I've heard of people literally stepping on a nail, not even knowing it's in their foot because they don't have any sensation left. So neuropathy can get to the point where you just don't feel anything.
Okay.
But till this day, I have seen absolutely zero medications, machines, anything that can heal neuropathy. Nothing. But yet there are products out there that you can get for the low price of $89.99.
Okay.
That can heal your neuropathy. It's just it's bogus. Yeah. It's a load of baloney.
Okay.
And there's other products very similar like that.
Yeah.
And it's personally, I think it's just false advertising. I think it's preying on people's problems and difficulties. Mm-hmm. But I see that. I've had plenty of patients buy various products, and they'll try them, which is fine, but they never end up taking care of the problem.
Yeah.
Ever.
Oh, yep. Your fly's real because it just flew over here. It's a little gnat. That's what it is.
And so now read that question back to me because make sure that
just tackling popular myths, facts, or controversial topics.
Okay. Gotcha. There are some other ones as well, in therapy and as well as other disciplines. Seems like ever so often they'll come out with a new machine or device that is supposed to address this major problem and make it better.
Yeah.
Oftentimes, not all the times, but I feel like more times than not, they typically don't solve the problems they're supposed to. Now, don't get me wrong, you know, I have some people that have knee pain and they'll go buy a compressive knee brace and it helps to alleviate it. But when I see a commercial that says, we've just come out with this brand new copper infused knee brace speckled with gold and silver.
Yeah, absolutely.
And it will take away your arthritis pain.
Oh, man.
That right there, it's a complete lie. And they're just trying to sell the product.
Yes.
If you got arthritis, which is basically just the degeneration of your bone, once you get it and it starts getting bad, there's no reversing it.
Cooked.
You're cooked. The only outcome down the road is you'll have to have, if we're talking about a knee, is a knee replacement.
Okay. Fair enough. So what about like the certain things? I legitimately don't have one, and I try to just stretch for this issue in and of itself. But like, you'll see things for like people that have like rounded backs where you can put them on like your shoulder and stuff like that in your back, and it's supposed to like, I guess, provide like a counter, like try to prevent you from getting into that position. What about things like that? Is that real at all, or is that?
So on that subject, may that alleviate some pain? Absolutely, it could.
Yeah.
You know, they've got all sorts of back braces for every situation. Is it going to cure the problem, you know, for the remainder of your life? Usually the answer is no.
Yeah.
Now, again, if the goal is just to cut your pain down, certain things can.
Yeah.
But depending on the person, I mean, I've got some people so bent over, I mean, their head is looking straight down and they can barely raise their head up.
Oh my gosh, Mike.
So,
did you meet my Nanny Carter, like before she passed away? Like she was I don't even know what shape of the alphabet, but it wasn't an I, you know.
And I mean, and here's an example. If you was in TiVo, you'd probably seen her before. There was a lady that she passed a few years back. She drove this very old, probably 1950, 60 kind of green looking car.
Okay.
This lady was bent over more than anybody I'd ever seen. She permanently walked like she was bent over, touching her toes.
God,
that was her posture,
man.
Okay. There was nothing. I had to go out and evaluate her once. There was nothing I could do that was going to solve her posture and problem with her spine.
Mm-hmm.
Chronically, she had been worsening year after year after year. And when you get to that point, there is nothing you can do other than you happen to find a phenomenal back surgeon that puts you through the ringer to try to address that problem. But even then, most surgeons won't touch it because it's progressed so badly.
For sure.
So, yeah, most products, they're never going to cure it. The goal is to just help it feel a little better.
I always wondered with Nanny, and she just passed away. So, Nanny, I love you and I miss you, and I'm giving you a hard time because I love you. But I always wondered, like, if people in her predicament, like, what would have happened if she had just every day, like, laid flat on her back to just try to, like, would that have done anything to try to counter, you know what I'm saying, if she's been over forward?
Yeah. So, did she sleep flat in a bed?
That I don't know.
Because
I don't know.
I will say, I mean, I've got some people that for years they do not sleep in a bed.
Yeah.
They sleep in a recliner in a bent position because they say it's the only way they're comfortable.
I wouldn't be. I need to find. There's people that know. I want to say she did sleep in bed, but I can find out. But she did spend a lot of time in a recliner.
Did she?
Yeah.
And it's hard to say. But in regards to that subject, oftentimes the problems have been worsening slowly year after year after year after year. And by the time typically people actually want to address it and say, hey, I need to get this fixed, oftentimes it's too late because your bones and your body has shifted and compensated to where everything's completely different than it was 25 years prior.
Yeah. So it's essentially like now, like just start now taking care of yourself.
Yes.
Start now taking care of yourself.
Yes. And again, going back to what I was saying with just like lifestyle changes. I mean, if you're somebody, if you noticed right now, I mean, we're in our 30s. If you noticed on
hey, listen, no.
But
no.
seriously, it is.
Man.
We'll take posture for example. If you noticed on a daily basis that you were constantly hunched over, and you was like, you know what? I looked in the mirror and I noticed that I am hunching over worse than I was last year, and it seems like it's getting worse. I'd say start now. Get you a lumbar pillow. Put it under your back anytime you're sitting down, whether it's in a car or at your house in a computer chair, to straighten up your posture. And if you feel the need to wear a back brace 1 or 2 hours out of the day, go for it.
Yeah.
Because you're better to do it right now than let it worsen and then have issues.
Yeah. I'll ask one more professional related question, and then I'll ask something more personal towards myself. But so with the physical therapy profession, you talked that it has kind of shifted to where people can have that direct access now, like, so that whether you call that progress or what, like, do you notice the profession in and of itself moving in any other directions? Like, is telehealth becoming more prominent, anything like that? Like, can you elaborate, I guess, in that regard?
Yeah. So in regards to telehealth really gained a head of steam when COVID hit.
Yeah.
COVID hit and telehealth became huge. Now we're transitioning everything away from telehealth and getting back to just the way things were before, with everybody coming into the doctor. Now it's still used at times, but it's not used the same. In terms of changes, so even though kind of like I talked about the direct access, we still, our company, for example, we still, every person we get referrals from our doctors. So that's how we see people, as a referral from primary doctor, surgeon, nursing home, you name it. Honestly, the biggest changes now that we're encountering, it's unfortunately more negative, and it's because of insurance.
Okay.
And since I honestly started physical therapy years ago, it seems like every year insurance has made it harder and more difficult for us to do our jobs.
Yes.
Because insurance seems to every year want to crack down more and more on one, how much they're willing to pay for,
Yeah.
and what they're going to allow.
Yeah.
And it's changing everything really within how the whole company's run.
Oh yeah.
And I mean, and an example just right offhand is I think it was Graves Gilbert, for example.
Okay.
I think recently announced that they were no longer going to accept, I think it was Humana insurance.
Yeah.
So if you have Humana insurance, you can't go to Graves Gilbert now
Gosh.
and get treated at all.
Can't like those Graves Gilbert employees.
And I was going to say, I think Amy works there.
She does.
Okay.
She does.
Yeah. But that boils down to, in the same way with the Mayo Clinic. The Mayo Clinic just announced, well, I can't remember which one in particular, but they announced there was an insurance provider that they couldn't come to an agreement on, and they said that they no longer could take anybody with that insurance. Yeah. And it's really hindering what we can do for people, because years ago it seems like I could show up and help people when I wanted, when I needed, and now I have to check the paperwork to make sure insurance is going to allow me to come and for how often I can come.
For sure.
So they pretty much control me in regards to how much I can see people. And that's something I try to explain to patients when sometimes they're like, well, can't we, is that all we can get? Can we not be seen more? And it's like, I would love to come out and see you 4 days a week if I could. But now with insurance, I can't. If I was to schedule you, insurance might cut me off after 2 to 3 weeks and say, all right, no more.
Yeah.
So we got to be wise about how we schedule people and how often because of that.
For us, I mean, I'm speaking on my own behalf, but I will say, like, where I work, insurance has also been a bit of a headache, but we have a great, gosh, I forget what her role is actually officially called, but I will say a compliance supervisor or a compliance officer, and she does a great job of, like, compliance officer. It's not it, but I like that. I'm going to start calling her that. But anyway, but she does a phenomenal job of making sure that everything insurance related is good to go. And anytime, like, we get audited, insurance audits quite a bit, and to my knowledge, there's only been one time that there's been any legitimate threat of recoupment or like wherever they would want us to, but it was I'm pretty sure there was an appeal and we won. But what I'm getting at with that is, if you have somebody that can do that for you, I don't know if the company you do does, but that would be great because it helps get rid of that overhead.
Yeah, our company's nationwide, and so we have a lot of employees. Thousands.
Good.
So typically, as soon as we get a referral for somebody, the people behind the scenes that communicate with insurance, they're already talking to insurance, getting the acceptance and saying, okay, we have permission for you to see them, and here's their insurance information.
Sure.
Yeah, we have to have that.
So the personal question I was going to ask, but honestly, after talking to you, I need to just go see a physical therapist. If I know a good one, I'll reach out to him. But
I got you, man.
I know. It was a joke. It was a subtle joke. But no, I mean, God, I'm just thinking, because, like, I've had surgery on my right knee, tore meniscus in both knees. Remember, I broke my hip in high school.
Sure do.
Broke my hip in high school. Tore my hamstring in 2022. Dude, like, I feel like I'm cooked. But let's say I start in general right now making lifestyle changes to mitigate any further complications from those issues.
Okay.
How comfortable can I make the rest of my life? Because I will wake up, like, I don't know if you ever wake up with Charlie horses, but I'll wake up where I tore that hamstring. I'll wake up with, like, essentially a Charlie horse right there on that scar line, like where I tore it. And it's awful. And that's been 3 years.
So I'd say one of the biggest things would be, especially if you can always maintain a healthy diet and weight, that'll make a big difference in the long run.
Yeah.
And particularly because we're talking from the hip to your knee joint being the big issues.
Oh yeah.
So because you've already had what you've had, you're already more prone to get arthritis built up in those areas. And kind of, well, we'll use some of the surgeons that I'm very familiar with. Oftentimes they'll have patients go in, and by the time I see the patient after the surgery, the patient will tell me that doctor said he would do my surgery, but he wanted me to lose X amount of pounds.
Yeah.
And not everybody likes to hear that, but the surgeon's honestly telling them that because it's in their own benefit.
Right.
It makes a huge difference. If you're at a healthy weight, it makes a huge difference on how long your joints last.
Right.
Trying to think, I had somebody recently, or a patient in the past actually, that they'd lost a ton of weight actually. I want to say they'd lost close to 100 pounds. And one of the big things that they mentioned was I was like, hey, you look great, man. I didn't recognize you. And he said, man, I feel great. He said, my knees and my hips, he said, they feel great. He said, I'm not having the pain in my joints like I was since I've lost all the weight. I'm like, that's great. And of course, he told me he was eating better too.
Yeah.
Along with that. So if you're giving your body the fuel that it needs,
Yeah.
so muscle, for growth and bone, and you're at that healthy weight to where you're not putting too much through the joints,
Yeah.
I think it makes a huge difference in the long run.
Yeah.
Huge. Along with, too, I think exercise makes a massive difference. Keep up your muscle mass, big difference.
And two, I think it's just human nature, which I could go into the psychology of this, but I'll save it for a completely different episode. But I think sometimes we want a special answer when it's really just take care of yourself.
It is.
Just take care of yourself. Take care of yourself and don't look for quick fixes. Make healthy decisions in the long run. You don't have to be perfect.
Yeah.
And I mean, you see that in every aspect of your life, mental health, physical health, spiritual life, just take care of yourself.
The unfortunate part is, and I'll say just the United States, for example, compared to other countries similar to us, I feel like the U.S. is fixated on everyone wants a quick fix for their problems.
Absolutely.
Instead of actually making the right choice, which is lifestyle change. I feel like it's different in a lot of other countries. If you was to go to Europe, for example, in Europe, typically they take significantly less medications.
Yeah.
And they focus more around eating healthier meals, whole meals. But that is a mindset now that I wish could fix. I don't know how it'll ever change, but the idea of don't seek the quick fix. Seek the long run of benefiting yourself for the remainder of your life by just making small changes in your life for the better.
Yeah. I think because you remember how big I was before I ever enlisted. Like I was a big guy. Like you lost 300. I was
going to say you lost a ton of weight.
Well, from the time that I started losing weight to enlist, from the time I started losing weight to enlist to the time I graduated basic training, I had lost over 100 pounds.
Yeah.
Of course, I've gained like half of that, or if not more, back over the past 10 years. But one thing that helped me was I did have that goal. Like I wanted to enlist and I knew I needed to. And I did, like, I had like a lot of shame for who I was and stuff like that. And so I had to like convert that into motivation to, like, I had to believe too that like if I did put this effort in, it would make those changes. Like it would bring about a positive change.
Yeah.
And it did. But now where I've gotten, and it's whether it's selfishness or what, I've like, all right, I've already done that. Now can I just do a quick fix? But it's like, no.
Yeah.
You're going to have to take care of yourself.
Oh,
and
yeah.
So,
and I think too, just to last thing on that.
Yeah.
I'm going to be honest. It's never going to be easy.
No.
Doing it the right way. It's always going to be worth it, but it's never going to be easy. And that's what I would tell anybody if I'm sitting here talking to a patient, like, here's the best choice. Here's the right choice. But it is going to be the harder choice.
Yes.
But typically the harder choice is oftentimes the best choice.
Absolutely.
And it's kind of like Tom Brady once said in a speech, for all those that are familiar with Tom Brady.
Nobody's familiar with Tom Brady.
He said, this probably wasn't that long ago, but he said something along the lines of, he said, you don't have to be the most talented or the most naturally gifted at doing this or doing that. He said, all you have to do to be great or do what you want to do is do what everyone else isn't.
Yeah.
And he said that's being consistent, working hard, and being self-disciplined.
Yep.
He's like, if you can do those things, he's like, you can do anything. He's like, but you have to have those things in order to do and be what you want to be. And
Yeah.
I completely agree.
Absolutely. I do as well. And it's I think you said earlier, it's just not fun. It's not comfortable. It can be downright awful at times, but that's why very few people do it. But being on the other side of it, and speaking from experience of being on the other side of it, it's so worth it. And then also, it's not as bad as you think it is. And it's not as bad as you thought it was when you were going through it. I mean, you just got to do it. But man, I really appreciate you coming out, dude. That's awesome.
Of course, man.
And I'd like to get back on at some point. I think we need to get the River Breeze boys like on to have like a,
We could do that.
just to sit down
We could even
telling stories, you
we
know.
could do a group sit down. That would be fun.
Yeah.
That'd be a lot of fun.
Yeah. I'm trying to get Foot to come on to talk about being a superintendent.
Principal, right?
Or excuse me, yes. I spoke with a superintendent yesterday,
Gotcha.
but he's principal. Yes. He is principal over at the freaking trader, but Greene County. It is what it is, you know.
Hey, it's all right.
You gotta love people where they're
I was
at.
gonna say we love them no matter what.
Yeah. All right, man. Well, thanks for coming out. I appreciate it.